Now, the Bono East Regional Director of Health, Dr. Fred Adomako-Boateng, is asking the government to consider establishing an accident emergency center along the Techiman-Kitampo-Tamale highway to provide immediate care for accident victims. He's optimistic this will save lives as accident victims will be stabilized before being referred to other major health facilities across the country. Anna Sabet has more.
The Techiman-Kitampo Highway is noted for recording more accidents with fatalities in the country yearly, and the absence of an accident and emergency center along the stretch to cater for accident victims has contributed to the high number of deaths from road crashes over the years. Bono East Regional Director of Health Services, Dr. Fred Adomako-Boateng, says the creation of an accident and emergency center would help stabilize accident victims before being referred to major hospitals in Tamale, Techiman or Kumasi.
If you look throughout the country, I will state this again. Bono East alone is about 10% of the whole landmass of the country. Then if you look at the Bono Ahafo, Bono East is about 2/3 of the landmass. Look, if you are really coming from Tamale, that stretch till you get to Techiman, have you seen the stretch? It's so, the roads are good, comparatively better, and it's accident prone. We have countless cases, but the question is, when we have, it's not a matter of if, because that is a human institution. Based on all the remedies that we have, when we have, what do we have to do? We need an area where we can really stabilize people along the stretch.
He says this has been the directory's plea for the past few years, adding that a 15 to 20 bed capacity structure would at least help save lives of survivors of road crashes along the stretch.
It has been advocacy for how many? 4 or 5 years. There is a need for Bono East in this stretch to get areas, accident and emergency, is it about 15, 20 beds where we can really stabilize? Because when there is an emergency, 1 minute, 2, 3 minutes is of a sense. When we don't really manage all these very well, we can airlift you to the first class. Your survival is questionable. We need that accident and emergency around that enclave for Bono East, for Bono, and for the country, for the northern part, all coming. That is our cry that we will have to get. We all know the accidents that have happened across. The recent one, some bodies were even charred. And then we lost a lot of them, even at Kitampo North Hospital. But this is our cry and the need for us to get.
Anna Sabit, Joy News, Kitampo.